Another day, another video of first aid by. What causes hemorrhoids? Symptoms, diagnosis, treatment, and prevention. Hemorrhoids, also known as piles, are swollen veins in the lower rectum or anus. This common condition affects both men and women, and can occur at any age. Hemorrhoids can cause discomfort, pain, and itching, and can be a source of embarrassment for those who suffer from them. What are hemorrhoids? Hemorrhoids, commonly known as piles, are swollen and inflamed veins in the lower rectum and anus. They can be internal, occurring inside the rectum, or external, developing under the skin around the anus. Hemorrhoids are a very common condition and can range from mildly irritating to extremely painful. The most common cause of hemorrhoids is straining during bowel movements. Other contributing factors include pregnancy, aging, chronic constipation or diarrhea, and anal intercourse. Obesity and a low-fiber diet may also increase the risk of developing hemorrhoids. Sitting for long periods of time can also contribute to the development of hemorrhoids. How common are hemorrhoids? Hemorrhoids are a common problem that affects nearly half of the population at some point in their life. The exact causes of hemorrhoids are not fully understood, but they are believed to be caused by a combination of factors, such as straining during a bowel movement, chronic constipation, sitting for extended periods of time, pregnancy, aging, and genetics. Other risk factors include anal intercourse and heavy lifting. Who might get hemorrhoids? Hemorrhoids can affect anyone, though they are more common in adults ages 45 to 65. They can be caused by a variety of factors, such as straining during bowel movements, obesity, pregnancy, sitting for long periods of time, chronic constipation, and diarrhea. Other factors that can play a role in the development of hemorrhoids include a low-fiber diet, not drinking enough water, and a lack of physical activity. People who have anal intercourse may also be at risk of developing hemorrhoids. What are the types of hemorrhoids? Hemorrhoids are swollen and inflamed veins in the anus and lower rectum. There are two types of hemorrhoids: internal hemorrhoids, which are inside the rectum, and external hemorrhoids, which are outside the rectum. Internal hemorrhoids usually cause less severe symptoms compared to external hemorrhoids. Common causes of hemorrhoids include straining during bowel movements, prolonged sitting, pregnancy, obesity, and chronic diarrhea. Other factors that can contribute to the development of hemorrhoids include heavy lifting, anal intercourse, and a low-fiber diet. Internal and external hemorrhoids. Hemorrhoids are a common condition that can affect people of all ages. They can be both internal and external and are caused by increased pressure in the lower rectum. Internal hemorrhoids occur due to the increased pressure of straining during bowel movements, pregnancy, and even sitting for long periods of time. External hemorrhoids are caused by the veins located around the anus becoming swollen and engorged. Other causes of hemorrhoids include a low-fiber diet, constipation, and obesity. Treatment for hemorrhoids can include over-the-counter medications, lifestyle changes, or surgery in more severe cases. Taking good care of your health is key in preventing and treating hemorrhoids. Rubber band ligation of hemorrhoid. Hemorrhoids are swollen veins in the lower rectum and anus. They are caused by increased pressure in the area, which can be due to pregnancy, straining during bowel movements, sitting for long periods of time, and obesity. Rubber band ligation is a procedure that can be used to treat hemorrhoids. It involves placing a rubber band around the base of the hemorrhoid to cut off the blood supply. This causes the hemorrhoid to shrink and eventually fall off. It is a relatively simple procedure, and can be done in a doctor's office. It is generally well tolerated, but there is a risk of infection and bleeding. In this video, we will discuss the symptoms, causes, diagnosis, treatment, and prevention of hemorrhoids. Symptoms. The symptoms of hemorrhoids can vary depending on the severity of the condition. Some common symptoms include 1. Pain or discomfort during bowel movements. 2. Itching or irritation in the anal region. 3. Swelling or inflammation around the anus. 4. Bleeding during bowel movements. 5. Mucus discharge from the anus. 6. Lump or bulge near the anus. What causes hemorrhoids? Hemorrhoids are swollen and inflamed veins in the lower rectum and anus. There are several possible causes of hemorrhoids, including straining during bowel movements, constipation, and sitting for long periods of time. Other risk factors include pregnancy, obesity, and a low-fiber diet. It is also believed that aging can contribute to the development of hemorrhoids since the tissue supporting the veins in the rectum and anus can become weak over time. Causes. Hemorrhoids can be caused by a variety of factors, including 1. Straining during bowel movements. 2. Chronic constipation or diarrhea. 3. Sitting for long periods of time. 4. Pregnancy and childbirth. 5. Obesity. 6. Aging. 7. Anal intercourse. 8. Inherited tendency. Diagnosis. A doctor can diagnose hemorrhoids by performing a physical examination of the rectum and anus. In some cases, a visual inspection may be enough to make a diagnosis. However, if the doctor suspects that there may be an underlying condition, such as colorectal cancer, a more thorough exam, such as a colonoscopy, may be necessary. Treatment. The treatment of hemorrhoids will depend on the severity of the condition. In mild cases, self-care measures may be enough to provide relief. These measures include 1. Eating a high-fiber diet to prevent constipation. 2. Drinking plenty of fluids to keep the stools soft. 3. Taking over-the-counter pain relievers, such as ibuprofen or acetaminophen. 4. Applying ice packs or warm compresses to the affected area. 5. Taking sitz baths, soaking the affected area in warm water for 10 to 15 minutes several times a day. If self-care measures are not effective, a doctor may recommend other treatments, such as 1. Topical medications to relieve pain and itching, such as hydrocortisone cream or suppositories. 2. Injections to shrink the hemorrhoid. 3. Rubber band ligation, which involves placing a rubber band around the base of the hemorrhoid to cut off its blood supply. 4. Coagulation therapy, which uses heat, laser or infrared light to shrink the hemorrhoid. 5. Surgery, which may be necessary in severe cases, such as when hemorrhoids are large and prolapsed. Prevention. There are several steps that can be taken to prevent the development of hemorrhoids, including 1. Eating a high-fiber diet to prevent constipation. 2. Drinking plenty of fluids to keep the stools soft. 3. Avoiding straining during bowel movements. 4. Exercising regularly to improve bowel function. 5. Taking breaks from sitting for long periods of time. 6. Avoiding anal intercourse. Hemorrhoids are a common condition, and it is estimated that up to 75% of people will experience them at some point in their lives. They are more common in people over the age of 50, and in pregnant women, but can occur at any age. Hemorrhoids can be internal, external, or both, and the severity of the symptoms can vary from person to person. Internal hemorrhoids are located inside the rectum and are not visible from the outside. They can cause bleeding during bowel movements and may protrude through the anus if they become enlarged. External hemorrhoids are located outside the anus and can cause pain, itching, and swelling. They may also bleed if they become irritated or thrombosed. A blood clot forms inside the hemorrhoid. Hemorrhoids can be diagnosed through a physical examination, but other tests may be necessary if the doctor suspects an underlying condition, such as colorectal cancer. These tests may include a colonoscopy or a sigmoidoscopy, which allow the doctor to examine the rectum and colon more closely. Treatment for hemorrhoids can vary depending on the severity of the condition. In mild cases, self-care measures such as dietary changes, exercise, and sitz baths may be enough to provide relief. Over-the-counter medications such as creams and suppositories may also be helpful in reducing pain and itching. In more severe cases, medical interventions may be necessary. These can include rubber band ligation, where a rubber band is placed around the base of the hemorrhoid to cut off its blood supply, or coagulation therapy, which uses heat or laser to shrink the hemorrhoid. Surgery may also be necessary in severe cases, such as when the hemorrhoids are large and prolapsed. Prevention is key when it comes to hemorrhoids. Eating a high-fiber diet, drinking plenty of fluids, and exercising regularly can all help to prevent constipation and reduce the risk of hemorrhoids. Avoiding prolonged sitting, especially on hard surfaces, and taking breaks to walk around and stretch can also help. Finally, it is important to avoid straining during bowel movements and to seek medical attention if symptoms persist or worsen. In conclusion, hemorrhoids are a common condition that can cause discomfort, pain, and embarrassment. While they can be caused by a variety of factors, including straining during bowel movements and pregnancy, they can often be prevented and treated with self-care measures or medical interventions. If you experience symptoms of hemorrhoids, it is important to consult a doctor for a proper diagnosis and treatment plan. Thanks for watching.